This video is obviously based on the new study on a sauropod dinosaur's neck bones, but I want to first acknowledge the authors and just how easy and fun this paper was to read. Not only does it still fit in all terminology it needs to and discusses everything within the restrictions of an academic paper, but it exemplifies exactly what I want more of among science papers. It constructs an image for the reader while keeping to the core principles which have stifled academic papers for quite a few decades. Just because you're describing some bones doesn't mean you cannot also tell the story of those bones. It will only help more people get into your science, and the more people interested in and studying the same thing you are, the better. So, a very special thanks goes to Cary Woodruff, Director of Paleontology at the Great Plains Dinosaur Museum, or Double Beam on Twitter, Ewan Wolff, sauropod vertebrae expert Matthew Wedel from the College of Osteopathic Medicine of the Pacific at the Western University of Health Sciences, Sophie Dennison of Televet Imaging Solutions, and the venerable Larry Witmer of the eponymous Witmer Lab, where all the coolest paleontological CT scanning occurs. I hope this video does your work justice. On the off chance any of you are watching, call me. I'm an actual student as well as a YouTuber and would love to collaborate in any way I can on just about anything you got lying around. The fossil record and our understanding of it has been based almost entirely on the bony bits that managed to make it through thick and thin to become the fossils we all love to learn about. This, unfortunately, means that our entire human understanding of the past is based on only the hard, mineralized scaffolding of very dead things. Paleontologists used to say that fossilization could only occur with bony bits. Therefore, unless other living tissues were preserved on or near the bones, no one could draw any conclusions on the life appearance or habits of extinct organisms. During these grayer days, inferences on the living part of dead organisms were made from comparisons to living relatives. That didn't get anyone very far, particularly for the dinosaurs. All of that old thinking has been crumpled up and tossed out the proverbial window over the last few decades, as new technology, new techniques, and new samples have shifted the paradigm of what paleontologists and geologists thought they knew about the processes of fossilization. All that new stuff I mentioned has improved the understanding of myology, connective and cutaneous tissues, pigment-carrying cells, feathers, fur, hair, filaments, nostril size and position, the presence of cheeks, lips, facial sensitivity, nasal canals, ear canals, the brain, and the blood vessels that labyrinthed their way through the skull. These developments are piecing the past back to life and pasting the flesh back to the bones of our ancestors and cousins beyond anyone's wildest dreams. Working out these major biological and physiological puzzles has been the cutting edge of paleontological science for the last 30-ish years, but it is the finer details of the lives of many of these extinct animals that open up a rarely glimpsed, more intimate window to their inner workings. In other words, some of these bigger things can provide context or inference to parts of an animal's life that cannot fossilize. Trackways, for instance, show us predator-prey interactions that may be impossible to show up among bones alone. These fossil footprints can even show courtship displays that could otherwise only be imagined. Nests and eggs provide information and data on parental care techniques between different dinosaur families. Finally, even something as obtuse as the mahogany or slate-colored bones of the great beasts have begun to show us incredibly personal things. The way in which the bone is shaped, or the morphology, can sometimes preserve pathologies, or the leftover evidence of pain. Bones that have broken, and bones that have healed, bones that have grown where they're not supposed to, infectious and non-infectious forms of arthritis in the joints, and finally, infectious disease. This last one is rather important, not just to our understanding of the lives of these past beasts, but to our lives today. the ins and outs of the evolution of diseases is excruciatingly important to the understanding of how they work today, and how we can fight and hopefully slay them. Pathologies in the bones of extinct animals have been known for some time, but were rare. Don't get me wrong, they're still rare, but a bunch of bones previously thought to show evidence of combat are being found to actually show evidence of disease. This upturning of old evidence is going to help triangulate the cause, origin, and evolution of the many diseases which plague animals today, including us. So, let's look at the numbers. What do we have for the dinosaurs? What hard evidence exists of the horrible misfortunes which befell them? Trauma associated with blunt force, and penetrating trauma like deep cuts, broken bones, dismemberment, and all sorts of other gruesome, gross maladies. Many different flavors of arthritis love to leave a hard, obvious mark on dino bones. Uncontrolled bone growth, infections of the bone, blood parasites, and transmissible diseases like trichomoniasis, an infection in birds caused by a protozoan. Respiratory diseases are largely absent from the fossil record. This is definitely because they most often more heavily affected the soft tissues, like lungs and whatever weird squishy membranes there are in the sinuses and the like. These are very common diseases among the living members of Archosauria, birds and crocs. These respiratory diseases can include such horrible afflictions as inflammation, bacterial infections, viral infections, fungal infections, mycobacterial infections, cancerous growths, and the good old-fashioned parasitic infection. The oldest known fossil evidence of a respiratory disease was some form of tuberculosis-like infection in the bones of a 245-million-year-old marine reptile known as a nothosaur, the cousins and precursors to the plesiosaurs. Now, a brand new study published in February 2022 by Cary Woodruff, Ewan Wolff, Matthew Wedel, Sophie Dennison, and Larry Witmer describes the remains of a sauropod dinosaur that preserved the effects of an avian-style pulmonary infectious disease, the first time such a disease has ever been described in a dinosaur. All the way back in 1990, a team from the Museum of the Rockies of Bozeman, Montana, were out in southwestern Montana in the O'Hare Quarry, chipping matrix away from bones lodged in a layer of the world-renowned dino-fossil-choked Morrison Formation. These bones belonged to a long-necked dinosaur, a sauropod dinosaur. These bones were rather extraordinary for a sauropod dinosaur, as it contained a relatively complete skull, a rarity among long-neck fossils, as well as the first 7 neck vertebrae, all aligned as it was when the animal died. This quarry was then reopened from 2013 to 2015, when a lot more fossil material was recovered from both this long neck and a bunch of other dinosaurs. This second spout of fossil excavation uncovered more material from the non-head and neck parts of the skeleton. Do you recall the name Diplodocus? This is the name of a very long, possibly one of the longest sauropod dinosaurs that starred in the second episode of Walking with Dinosaurs, and populated many a museum's main hall or entrance. This Montanan longneck is very closely related to the Diplodocus. The sauropod dinosaurs were able to attain such heights, lengths, and widths while being terrestrial creatures by reducing the amount of space they took up on the inside. Instead of heaping helpings of unnecessary muscle and fat, these dinosaurs had a series of air sacs throughout their bodies that ate their way into their bones in some spots. They also had hollow bones with some reinforcing bony struts for strength. This is how these animals kept their theoretically tremendous weights down. Instead of an 85-foot animal weighing 100 plus tons, it may have weighed no more than 16. Those weight-saving air sacs connected to the respiratory system of the animal in a similar way to those in their modern cousins, the birds. The air sacs also left behind proof of their existence in the bones of the sauropods, especially the neck bones, which have many muscle scars, holes, and are structured like bracers for some complex antediluvian bridge. When a dinosaur like Diplodocus got a respiratory infection, it would infect the air sacs and leave behind evidence in the neck bones. And this is what the new team investigated. To do this, they visually noted lesions in the bone where the air sacs would have inserted into the bones, then took photographs of all lesions. From there, the team sent 2 of the vertebrae through a CT scanner in Malta, Montana and Bozeman, Montana to get the dirt on what was going on inside the bones. In the first round of observations, the researchers found that the outside of the long neck's bones showed clear signs of infection. Enough neck material is known over a bunch of different Diplodocus specimens that the default texture and anatomy of the bones is known. This pathologic specimen had asymmetrical changes in the texture of the bone. Where the air sacs entered the bone, the texture is very nodular and undulating where it's supposed to be smooth. It's sort of like cauliflower. Where there's smoke, there's fire, and CT scans found that fire. With the CT scans, the research team was able to see exactly what was going on in the bones of this poor dinosaur. They found a ton of lesions protruding from the surface of what are called pneumatic fossae. Fossae being the holes or depressions in a bone. These lesions usually happen as a periosteal reaction. This means that something has infected the bone, causing some form of injury, and the bone reacted by making more bone. These bone growths are seen in both small and large scale across the neck bones. They are also present on both halves of the vertebrae, but are still asymmetrical. For those in the audience who are staunch skeptics on subjects for which they are not experts, the team was able to rule out these lesions as the side effects of the fossilization process squashing the bones because other unsquashed bones from the same part of the neck in similar dinosaurs are known. On top of the outside defects, the team also identified defects on the inside of the bone, which show up as osteolucent defects. The bones were CT scanned with X-rays. The X-rays created a bunch of slices. X-rays pass through the bone differently depending on bone density, so a section of bone will appear darker if it is less dense. The osteolucent defects show up in the dinosaur bone as dark holes or voids in the bone where there should be bright white normal bone. These defects are arranged haphazardly throughout the bones. They're very messy. They seem to be most concentrated around the abnormal lesioned fossae, or bone depressions and holes, the place where the air sacs inserted into the bone. What's weird here too is that the osteolucent defects are found in a part of the vertebrae called the median septum. It usually doesn't have voids. In other words, this chunk of bone ain't supposed to be hollow. Something real nasty was going on. What was that nasty thing? In veterinary science, it is rather easy to find your way to the source of a pathology, and not so with fossils. That being said, the location of the lesions pointed the research team to a possible diagnosis. If those lesions were closely associated with healed fractured bone, the team stated they could refer the lesions to the result of a fracture callus. Fracture calluses are known from other Morrison Formation sauropods. Bone spurs or lumps along the surface of a joint would lead the team to diagnose some form of arthritis, which is also quite prevalent among dinosaurs. Additionally, all evidence points towards non-avian dinosaurs having an avian-like respiratory system, since the pathologic areas of this Diplodocus-like long neck are specific to the areas of the vertebrae attached to the respiratory air sac system. It follows that the diagnosis for the dino would be something of the pulmonary variety. Pulmonary disorders are quite common and variable among living avian dinosaurs. Most are diagnosed from evidence left in soft tissues, but some are also diagnosed from damage done to the bones. Since our diplodocid friend here has no soft tissue, the research team can't reliably diagnose an exact culprit, but can narrow down the diagnoses to 3 nasty perpetrators: neoplasia, air saculitis, or pneumoconiasis. Neoplasia, tumors. Air sac carcinoma. Cancer of the respiratory tract is rather rare in avian dinosaurs. That's honestly not a big surprise to me. Those animals genetically predisposed to cancer of the respiratory tract would have probably died out of the gene pool over the millennia, since the respiratory tract is integral to flight, and flight is kinda, integral to life as a bird. Cancerous tumors are even more rare in the air sacs that run through the body. As rare as they are, they still occur. Woodruff and company cite tumors in the sternum of a parrot and in the humerus air sac of a cockatoo and African gray. Its presence in birds, despite its rarity, may suggest it is the culprit behind the sauropod's messed up bones. However, multiple tumors causing bony growths and bizarre voids inside the bone through all of the body's air sacs has yet to be described in birds, making it less likely to be the diagnosis of the sauropod. Pulmonary neoplasia. Adenocarcinoma is a type of cancer which begins in the mucus-producing glandular cells of the body. This type of cancer has been occasionally noted in the lungs of birds, specifically cockatoos. This cancer creates an unusual and specific type of pulmonary pathology. It can affect the air sacs connected to the lungs and vertebrae as they are tightly connected. Histology is the study of microstructures of tissues. When it comes to fossils, you cut out a slice of bone, attach it to a microscope slide, and then look at the bone under the scope and describe what is seen. This allows a more direct understanding of what was going on with the animal and its skeleton at the time of death, and provides information on age, life history, and potentially even sex. Though the bones of the sauropod were analyzed on the macroscopic level and through CT scans, histology was not performed. This would help to confirm or deny the presence of pulmonary neoplasia. What has been observed in the vertebrae of the sauropod does not currently support the presence of pulmonary neoplasia. Air saculitis. Air saculitis is a broad term describing inflammation or infection of the air sacs of birds. This affliction may occur as a disease on its own, but is often diagnosed with other afflictions such as pneumonia, bronchial disease, rhinitis, or sinusitis. As this is a broad category, there are many agents which can cause air saculitis, such as mycobacteriosis. Mycobacteriosis is caused by the eponymous Mycobacterium, an actinobacteria. This insidious little pathogen and its 190 species often causes lesions in the liver and gastrointestinal tract, with rarer instances of lesions in the spleen, kidney, air sacs and lungs, and bone marrow. In the vast majority of these cases, these lesions don't ossify or become hardened bone-like growths. The instances where they did ossify, they were restricted to previous arthritic joints, fractures, and central parts of the leg bone. Even though this kind of infection has been known to leave a mark on the respiratory tract of birds, the fact that they don't leave bony growths or lesions on the bones of the neck suggests this was not the cause of the issues in the sauropod. Chlamydiosis. This infection is caused by chlamydia. Unlike the last infection, this one almost exclusively targets the respiratory and pneumatic tissues of organisms, including birds. It results in flu-like symptoms and pneumonia. Today's dinosaurs are vectors for this disease. Even if they don't carry the bird-specific species of chlamydia, they can spread it to many other unrelated animals. Unfortunately for the quest for what afflicted the sauropod, chlamydiosis doesn't leave behind bony growths, but it does affect all of the respiratory tissues. This rules it out as the main culprit for the bony lesions, but does not rule out the possibility that the dinosaur may have still had chlamydiosis. In fact, whatever caused the bony lesions may have opened the dinosaur up to an infection by this disease. Since chlamydia is so speciose today and spread across most animal groups, it likely had some non-avian dinosaur-specific forms at this time haunting the dinosaurs. Aspergillosis. This affliction is caused by the fungus Aspergillus and its many species. It is considered the most common avian disease and affects the respiratory system, resulting in pneumonia. As the research team pointed out, it's a funny case of happenstance that the first paleontologically oriented record of aspergillosis comes from a flamingo dissection by a one Sir Richard Owen, the dude that named the Dinosauria. This disease can infect the eyes, brain, skin, joints, organs, and respiratory system with non-bony lesions throughout. It has been known to cause spinal deformities in young animals. However, since it generally leaves no bony lesions behind, it probably isn't the culprit we're looking for. Pneumoconiasis. This one is particularly horrible as it is caused by the inhalation of fine particulates like silica and asbestos dust. It can cause spongy bone and localized inflammation of bone over a period of weeks to months. In nature, though, this affliction most often occurs around volcanically active areas. Silica dust rains down from these volcanically active areas and then gets breathed in by animals in the area. There's even a fossil example of this with the hundreds of dead mammals at Ashfall Fossil Beds State Historical Park. The kind of volcanic event that can cause this is known to have occurred within the Morrison Formation, the layer from which the diplodocid sauropod came. But the Morrison is a huge layer with many smaller layers within it, and preliminary results of analysis of the exact layer doesn't show any evidence of the kind of volcanic event needed to cause this illness in this dinosaur. Plus, pneumoconiasis showed up in the mammals at Ashfall in many other parts of the body besides the respiratory area. So if this were the cause of the sauropod's illness, it should also show up in other places. So, what are we left with? What was it that was hurting the sauropod? Since there's no soft tissue left behind to give a precise answer, only a rough estimate can be made as to the general type of illness it may have been. It's better than nothing and narrows down the possible culprit to only a few things. The research team found that the only affliction that fits the best is ersacculitis, with associated osteomyelitis. Exactly which kind of ersacculitis it was remains unknown, and since mycobacteria, chlamydia, and aspergillus are extremely common today, and common today in the descendants of the dinosaurs, it is most parsimonious that it was one of these that afflicted the longneck. The team write that it is tempting to jump to the aspergillosis scenario as the cause for pneumonia in the dinosaur, since it is a fungus common among living dinosaurs which thrives in warm, humid environments, which the sauropod lived in. The team then goes on to warn caution for such a conclusion, since there is some room for doubt. The poor beast would have been having a rough time. It would have been rather skinny, as ersacculitis causes weight loss, on top of coughing, nasal discharge, fever, labored breathing, diarrhea, and lethargy. If the animal couldn't fight off the infection or get to a drier environment, death was the result. It remains entirely plausible that it was this disease that ended the life of our poor long-neck friend. Oddly enough, there are no fossilized sauropod lungs. Any information left on the bones of these dinosaurs goes to build up the understanding of how they breathed. Sauropods were extraordinarily bizarre animals, for they adapted to withstand the forces of gravity, unlike pretty much any other terrestrial animal, ever. They needed weight-saving mechanisms, huge billowing lungs, long stretches of blood vessels, huge vats of constantly churning acid and stones, an enormous, efficient, four-chambered heart, column-like legs, and shock-absorbing feet bones and fat pads. Starting at the second vertebra behind the head and ending at the 19th vertebra in the tail, fleshy air sacs invaded the bones. They caused a ton of spongy holes in the bones, which is termed pneumatization. This amazingly efficient system for keeping as much air inside and extracting as much oxygen from the air as possible was conversely susceptible to infection. It's not like our colds, where we just have it localized entirely within one part of our bodies. Sauropod infections may have caused problems in the neck, trunk, back, ribs, and tail. So, what did we learn? Sauropods are extremes, their bodies as well as their body's response to infection. Though most fossil remains are just bone, sometimes those bones can leave behind the telltale signs of life events that would usually only be visible in the soft tissues. This is the first known instance of a respiratory infection in a sauropod dinosaur and provides insight into the evolution of diseases, as well as diseases in dinosaurs. Only more infected bones will help continue to build upon these foundations. So, what are you waiting for? Go out into the field, go on a field camp, volunteer with a museum, and get out there to find more diseased fossils. The only thing keeping our understanding back is the lack of warm bodies to get the job done. And money. It's mostly the money. If only our society understood the value of science. For more interesting stories about nature, the history of life, or what goes bump in the night, subscribe, hit the bell icon for updates, like this video, and drop a comment in the comment section below. Thanks for watching. Special thanks goes to my elephant tier patrons, Thea Svensson, Staniforth Hopkins, Dinosaur, Chris Frampton, Biotaverse, Arda Bayer, and Christoph Hubbinger, as well as my Tyrannosaur patrons, Iron Bladesman, Henry Brennan, Danny Van Heck, and Dana Manchester.